And we are live. Good morning. Good morning. My
Morning.
name is Tracy Kay, and I am the Joyful Voyager. If you couldn't tell, I'm a travel agent. And today we're going to talk about a very special travel topic. Now, most of the time when you think about travel, you're thinking about vacation. And of course, we know people aren't really going on those right now. But there's another kind of travel that you really don't see being reported in the news, and it's affecting families and individuals everywhere. It could even be affecting you right now, or could affect you. And what it is critical care and travel. So I have a special guest today we're going to talk about this subject and explain what this is. I want to introduce her. I am so proud to know this woman. She has had over 4 decades in the home health industry. She is the founder and CEO of Eye Care Home Health. She founded this 26 years ago, and the woman was a starter from a young age. I mean, she graduated from high school at 16, and she continues, and her organization, herself and her staff, are on the front lines right now, caring for people in their homes. And she is also a consultant to help people plan, especially for the subject we're going to talk about today. Eye Care, Donna and her company, Eye Care Home Health, have been featured in the Washington Post and on WUSA. So she really is a servant to the community. So, one public service announcement before I introduce her. Both of us are suffering from severe allergies, so we don't have Rona, so if you hear a coughing fit in the middle of the broadcast, it's live, baby, it's all good, but it's just allergies. So without further ado, I would love to introduce to you Donna Ivey, CEO of Home Health Care. How are you, Donna?
I am doing great. Thank you so much for having me, Tracy.
And thank you for taking the time. So Donna, let's get into it. Let's tell our audience, what is critical care and how could it affect families and individuals?
So sometimes we think about critical care as someone's in critical condition in the hospital and they're not doing very well. But the critical care that Eye Care provides is that we provide caregivers and nurses and personal care assistants to be at bedside and to bring people from hospital to home. So that is a travel that we really don't think about. There's travel involved. Sometimes we've had people from Florida who have had to travel their loved ones up here on the train to get back home. And then we bring in the caregivers there.
That's an excellent, let me stop you for just 1 second.
Okay.
That's an excellent point that you just made. One, travel is, yes, when we hop on an airplane or you go someplace, another state, another country, but travel, think about it. We travel in our cars when we go places. That's travel. Mm-hmm. But you made another key point. You might have to bring a loved one home from the hospital in the location you're in, the town that you're in. But a lot of times people have to bring loved ones in from other states, etc. So we'll go ahead and continue.
Right. And so what we've also done is we have clients that they're not coming home from the hospital, but they're not doing well at home because they have a caregiver and they want to travel themselves. And so we have taken 2 cars with our caregivers and a husband and wife in their 90s to Delaware. We drove the cars there so that they could have 1 car there, and then we drive them back, and then we went back to pick them back up. So that's travel that we really don't think about because we really need a private duty caregiver. This gentleman, it was a judge who had a stroke, and the caregiver needed to be there with them. And so he wanted to go to his beach house, and we traveled with them to make that happen.
That's wonderful. Now, I think and we were going to talk about that at the end. We're going to give everybody a rainbow and a silver lining to think about for the future. But before we get there, I want to dig into something you're talking about now. There's obviously some steps that have to take place. You know, especially now with COVID being out there and the extra precautions we all have to take. There are some steps that people are now confronted with. Now, when you're going to bring somebody from a hospital, either locally or a physical therapy, you know, wherever from out of state. And now you've got to bring them back to a home that could or could not have other family members. So then they're confronted with, how do I handle this? So this is where your consulting services come in. So what do you do when you get a call from somebody who's confronted with this? How do I do this? And this is what I'm saying. This is going to affecting families. So please talk about that.
Thank you for bringing that up, Tracy. So the first thing we do is when we have a video conference with the family, we have a conversation about where the family member has traveled. Prior to coming home, we have many family members who have that live abroad or live in a state that could be a hot spot. So we need to know about that because we need to make sure that the person coming home is protected. So we interview them and we have a questionnaire for them. And we also have a questionnaire for all of our caregivers. It's online and it's on a regular basis, our care services rep calls. Where have you been? Where are you traveling every day? What facilities have you been in? And have you been protected and how do you feel? And so after we go through all of that, then we get prepared for bringing the client home. And we have a nice kit.
Oh,
this is our safety kit.
So you give these to the families?
It's we leave it at the family's home.
So what's in it?
What's in it? We have Lysol.
I'm glad you can find it because I sure can't.
We have we have homemade masks, and we also have FDA approved masks, right?
Okay.
All right. We have gloves and we have sanitizers, right? Because we want to keep everyone healthy. We have shoe protectors, we have gowns, we have all sorts of things. Those things, when people travel home, are extremely important to make them feel that not only do we care about the client, but I care about the caregivers. So I had a caregiver talk to me the other day and say, you know, I'm really concerned because the family members are coming they're traveling to the home and they're not taking precautions. They're not wearing masks. They're coughing in their hand. They're handing their family member medication. And so we do that. So people who are traveling to their family members' homes, they feel like because they're familiar, they don't have to take the precautions. And we are taking those precautions. So that caregiver wanted to leave the home because they said, I don't know if I can be there because I'm afraid of being ill and getting sick because the family members are traveling to the home. So what I did is I talked to her to say, I care about you. We will have a conversation, but we will also protect you. We'll bring these items out to you. So we're on our way out today to take that kit so that she can feel secure and safe. And then if the family members have needs for any of those supplies, we have absorbed the cost as a company and we're taking that on.
Thank you for doing that. And let me mention something too. I think a key part of what you do is when you say you consult with the family and you talk about, hey, where have they been? Where are they coming from? So you know if they're in an area where a high rate of infection is happening, you're ready for that. But I think you also, one of the services that you offer in the consultation is that you do kind of help the family educate them that even though these are your loved ones and you naturally want to just go to them and help because that's what it really is. They just want to touch and it's like, oh, and then it doesn't immediately pop to mind that, oh, I need to be careful here. So I think that's part of what you also talked about that you do, that you very lovingly and cordially educate the family about how to, especially integrating when you say somebody's coming into the home or this person's coming back to a home with family members. That's part of the service that you offer to take the load off of people so that it's a positive, it's like, this is not a great situation, but this is how we handle it. So yeah, I know you love grandma, but you know, this is what we need to do for grandma. And when we bring grandma home, this is what we need to make sure happens for you. So it needs to be you're safe, she's safe. So
exactly.
So you also, so what are some of the things that you share with people when they actually have to bring somebody home or they're going to someone's home?
So because we are a home care organization and we specialize in meeting the needs of clients and providing the personal care assistance where the nursing, personal care aide, and even an on-call doctor can come in, we also do a livability assessment. And so my husband's an engineer by degree, and he is a project manager. So he's on his way out right now as we speak. So he's not watching this broadcast, but he can watch it later. He and our clinical manager, Ashley, are on their way out to a client who has a spinal cord injury and will be home at 2 o'clock today. And they're making sure that the bathroom is, the doorways are wide enough to fit his wheelchair, his electronic wheelchair, and also to get him in for bathing and those types of things. And so not only are we making sure that is COVID-19 ready and infections down, but we want the person to be at home and be safe in their home as they travel from their rehab facility to the home.
Okay, wonderful. So this is what I really love about what iCare does. I mean, accolade after accolade, anywhere in social media, when you've been featured in the post, people say one thing, and you live up to your, that the Ivey family treats me like family. They treat us, we are their family. And this is what you say. You say, let our family take care of yours. And you truly do live that. Now, I want to talk about something critical that you're doing right now. I talked about you being on the front lines. So let's talk about your new initiative, the training that you're doing and what you're accomplishing there.
Thank you. Absolutely. So we know that by the year, the Washington Post article quoted a Mercer study several years ago that said by the year 2026, there will be 1.2 million vacancies in the healthcare field, and in particular, over 400,000 vacancies in home healthcare providers. And what that means is that in the event you have a loved one by the year 2026 that needs care, 423,000 of those people will not get care because there are not enough people getting into the industry. So about a year ago, we created iCare to Aid with a 2, iCare to Aid, and that is our training center. So we partner with another organization to help that happen online, where we do the online training. And then my daughter, who's a licensed physical therapist assistant, will come and do the rehab training in terms of telling them how to do transfers. And then we have nurses with over 50 years of experience that really help on what they need to do. So we bring value added beyond the online training for people, because we want people who love to care and want to make a difference to get into this field.
So you're hiring right now?
We are.
Okay, so you heard that, y'all. For those of you out there, and you made a good point. I didn't mean to interrupt, Donna, but I just wanted to make a point. Okay. Is that right now, people's lives are being turned upside down. The economy, life is going to go on. The economy will do what it's always done. It will adjust. And new jobs and opportunities will be created from this. That's the way business works. Things change. Some things may go away, but new things come up. So if you're considering, if you're somebody like Donna says, you love people, you want to help, she could teach you how to be safe while you do this on the front lines. That's what she does. But if you're looking for something new to do, this is an excellent field to get into, because chances are you'll be employed for many, 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 many years to come. So definitely give her a call. The number's down there on the banner. Give them a call, because you are training the healthcare workers of tomorrow.
Absolutely, absolutely. And we're going to do everything we can to keep you protected and safe. I don't want people to come into the field and say, you know what, I'm going to come in the field, but I don't know, I'm afraid I'm going to catch. Well, we do educational videos, training, and we provide you the tools at the client's home once you get there that you have, so that you can be protected as you care for clients.
Okay, so let me ask you something. Yeah. I mean, this is serious. COVID-19 is serious. Yes. But we've had terrible things like this in the past. I mean, we live with the flu twice a year, seasonal flu. and sadly, it also kills people.
Right.
And this is something, we've had other things, SARS, swine flu. This is a horrible thing. But now here's what would like you to share with us. Since this is a part of our existence right now, and what do you say to people, your healthcare workers, anybody that is concerned about getting this? What is the best, what do you offer them in the way of, hey, this is how you conduct your daily life with sanitation, what you do? I mean, obviously we know about social distancing, but the special things that you know about how to sanitize things, why don't you talk about that, like in the home? I always see you with your sanitizer. I mean,
we've had them a long time. They're always in the pocket. They're always on.
You ought to just wear them as earrings. I mean, it matches your dress. So, her company colors are red and white. It matches your Hawaii dress.
Absolutely.
But yeah, so listen, you carry hand sanitizer.
I love them. They're great. We've had them for years. And so what I do is I kind of liken this to, because I've been doing this for almost 27 years for eye care, and then 31 years in this area, and then 43 years total.
She started when she was 12.
I know. So, but what I try to do is, much of what happens to us is in our mindset, right? And so most of the time, if you think you're sick, and I know Corona is real, all ailments are real. I'm not saying that. I'm not saying that you can think positive and it's going to go away. But when you start thinking about more proactive instead of reactive things, and that's why we've had sanitizers for over 6 years, always with our caregivers. But the mindset when you get ready to go and meet a client and be in someone's house, think about how it feels if you had someone coming to your home. You would want them to put on those shoe protectors and, have a mask. So just kind of turn the tables, see how that feels. And then you start to really, really think about what that really means and take it to another level. And I would like to not allow fear to be your motivation, just care.
That is a wonderful thing to say. I think that fear will paralyze you.
Right.
I mean, caution, yes.
Absolutely.
But rather think about care rather than fear.
Right.
So this is a wonderful way that we can take care of ourselves in our homes, the normal sanitation things that we do. But when we go out, I think you hit the nail on the head. How would I feel if the roles were reversed? I mean, even if you're going to, like I was in Home Depot the other day, boy, oh boy, was I self-distancing.
Sure.
And it was great. People were but it's like I tried to think, you know what? I'm going to be respectful of this person over here. I'm going to make sure sanitation over there, because I don't want to get sick, but then I also don't want to put somebody else at risk. And I think if, like you said, care, let's care for each other and let's not fear. And I think that will help us to get through that.
Exactly. And I do believe we need to be mindful and cognizant. And I think all things happen for a reason. I'm a believer. So
yes, so am I.
Mistakes, and he can use even this situation we're in to draw us closer to him, and then cognizant and mindful of others. And so, for example, so when I go into a home, or when I'm taking care of my loved one, let's just say you don't even have a caregiver, but you're taking care of your loved one, you're going to be a lot cleaner doing that. You're going to wash your hands a lot more. When you take off the sheets from the bed, instead of taking off the sheets and throwing them on the floor, you're probably going to be more likely to fold all the corners in, right? And then take it and put it in a bag, and then take the bag to the laundry room and put them in. So there are just small little things that you're going to likely do, whether they have Corona, the flu, the common cold, or any virus. It just makes you more mindful. And I think that's going to be beneficial for us in the long run, no matter what.
I think you also said something there about when you change the bed. I think that's something you teach people.
It is.
You know, this is how, you don't take them, just toss them. You want to take it off the bed a certain way. You want to put it in something, transport it. Then when you want to wash, you know how many times I wash my hands? Oh my gosh, it's just me. I mean, and then you wash your hands, and then you think about, you wipe down the surfaces. So these are the kinds of things you help people with. And you know what I've loved about our conversation this morning is that we're talking about a very serious subject.
Yeah.
And I'm glad we talked about it. This is a really big thing in the community. I don't see it in the news anywhere. Yeah. People are struggling with this every day. I mean, it could be as simple as, and not even talking about Corona, somebody could have fallen. I knew a lady that was riding a bicycle, fell down, and then that was it with her knee. It was the orthopedic surgeon, it was physical therapy, you know, whatever. And then, yeah, how do you bring them home safely from a physical therapy place or whatever it is? Wow. And these are things that you can get confronted with overnight. It doesn't have to be that. And so.
Sure. And we generally get confronted with it almost overnight. I mean, sometimes we have 24 to 48 hours to, the hospital will say, you know what? The person has to leave, or the rehab center said they've extended their time, or insurance is no longer going to pay, and we need you to get things set up. So that means we've got to get all the prescriptions ready. We have to know how to pick them up. We have to actually have hospital beds, walkers, wheelchairs, all of that. And we have to engage with the transportation company to, especially if they have to be on a stretcher or a wheelchair, to engage that company to get all of that done within a usually 24 to 48 hour period, and to get them home. And then we have to check with those companies in this environment that they're using universal precautions, that they're wearing masks, that they are safe, because we don't want transmission happening in any level. We want to minimize that.
Now, see, and you raise another good point. What you just described here is probably, with all of the great things you do, this is the greatest thing. You take a weight off the family members that are dealing. You just described an entire cascade of things that have to happen. Coordination between all of the parties, whether it's the equipment, the transit company, any of that stuff. And then not to mention that you have to make sure everybody's crossing their T's, dotting their I's, and all of that. And that's something that you take off of.
That's right.
The family. And then that right there is valuable. Yeah. Yeah, and so somebody just put a comment in here. So he says, he's been listening to this. He says, very hard when those who need care are in the most at-risk category, and for those dealing with cognitive impairments, it's even harder. So that's a good point. That's what right. About somebody, because you deal with people that have cognitive impairments.
We do.
So let's talk about that a little bit.
Yes, we deal with people who have the most popular cognitive impairment is dementia. So we've had clients with various forms of dementia, including Alzheimer's. And sometimes we have to have caregivers round the clock, because what happens is that people with dementia they do this phenomenon called sundowning. So they stay up at night. So it's harder for them to sleep. So you have to have 2 12-hour shifts, so that you don't have one person working 24 hours, but you have 2 people. So people are awake 24 hours. And what we do is we guide them in the things they like to do. And we don't tell them, no, you can't. We just have to guide them in the right direction. So those are the most common. I did have several years ago a physician who had a son who was in medical school and had a nervous breakdown and had a mental breakdown and was suicidal. And so we had to bring in a caregiver just to walk around with them, just to be at the house, just to stroll the mall and just make him feel comfortable. And so a lot of what we do too is just to be that extra person, those eyes and ears, and guide people instead of having to do for them, because we always want people to do the maximum amount of what they can do. And then we just give you the extra boost and help.
Now, another excellent point, Donna. Right now, there's a lot of people mentally suffering that this situation has exacerbated any depression symptoms they might have. There are and it's just terrible. People contemplating ending their lives
Absolutely.
because of this. So this is something y'all out there in broadcast land, if you know a family that's got a family member who is suffering deep depression, loneliness, they just need that extra help and somebody there with them. You may not be able to do that. Call Donna's company, I Care Home Health, because they can come in there and be that shoulder and and get that help, get that person over this hump, because we know that we'll get on with life,
Right.
but we want to make sure we don't want to leave. And you talk about not leaving anybody behind. And this is what we don't want anybody left behind. So what we're saying, if you need help, this is a great way to reach out to her, because her company does do so much, and you do so much for the residents in the home too. I mean, until recently, I don't know if you're still doing this, but you were doing spa services.
We were. Absolutely.
Yeah.
After the lifting of the stay at home, yes, we do complimentary salon and spa services to the client, to the person who's receiving care, or anyone in their family. And so once we're no longer under the stay at home and essential workers, yes, we do offer that.
But the in-home, you're still doing that kind of thing, just not the salon services.
Yes, the in-home we're absolutely doing. Yes.
Okay.
But and in some senses, while we think that the salon is essential,
I look like Rapunzel at this point. Are you kidding?
Right,
I haven't seen my.
But at any rate, it will be back very soon.
Yeah, it will. Now, let's end on a happy note. I want to talk about that wonderful dress you have on. Yeah. Everybody, Donna showed up this morning in her Hawaii dress.
Because we were traveling.
Because we were traveling virtually. And we know that nobody's traveling right now, but she loves Hawaii. So she was wearing her Hawaii dress. And so I want to talk about, again, let's circle back about when we do get back to traveling all these fun places, Hawaii, Europe, around the country, wherever we want to go. And I'm here to help you with that if you need it. But when we're ready, the great thing about what you do is that people can go, like you said, you can drive somebody to Delaware. You can go with somebody on a trip to Europe. You can go with somebody, you'll send a caregiver. So for those of you who have reached out to me that have wanted to send your parents, say, on a trip, and they may be older and have some health concerns, and you're concerned about them going, well, I'm not sure they can make it. Guess what? Donna's company there, I Care, is there to help you so that you can go with them. You can all enjoy the trip because there's somebody there taking care of your loved ones.
Right.
So something to look forward to. Travels for everybody and nobody left behind.
Absolutely.
Okay, so Donna.
Yes.
I have to ask this question. I did this with another friend of ours. Let me see if it works with you.
Okay.
Okay, what was the most embarrassing travel experience you've ever had?
Oh, I got it. It came right to me.
Okay.
The most embarrassing travel experience I had is when Tony and I took our first cruise in 1996. We went to the Bahamas. It was an amazing time. We loved it. I had never been to a formal beach in my life in that time. So we went, we were in Paradise Island. We're having a wonderful time. I didn't wear a bathing suit because I didn't think we needed a bathing suit. So I had on my shorts and a t-shirt or whatever, and Tony did too. So we said, let's get in the water. I said, no, I don't want to get in the water in my clothes. He says, oh, we're on vacation. No one will know. We get in the water. We're having a great time. And all of a sudden we hear the horn for the cruise ship. Like it was time to go. And I'm like, we're having so much fun. So we get out of the water and we're running and we go and we get in line and we get in these cabs. They're not really cabs. They're just like cars with no windows. And we're in line and we're about to get on, and the guy says, you're not getting on here. You are too wet. And look at all that sand over. And I'm thinking, oh my gosh, I'm not going to get back home. So we had to get out of line. We had to go in the bathroom. We had to try the dryer. We had to dry ourselves off and get all the sand. And needless to say, we made it. That was so embarrassing because there were so many people in the line, and they're probably saying, these people don't know how to travel. So to say after that, I wore a bathing suit in any cruise or any travel under my clothes for the rest of my life, anywhere I go. So that
Oh,
a good hit.
okay.
That was pretty embarrassing. So
Oh, oh, honey, that was very, I could top that. Should I tell on myself?
yes,
Okay. So, you know, I took a trip to Poland last fall
yes,
with our dear friend Stephanie.
right,
Well, let me just share this with you. Do not, you know, your body, and I tell people when you travel, your body, you know, it's kind of thrown into out of whack because you're out of your regular routine.
right.
Well, I decided I didn't want to be hungry. We had an overnight flight going to Europe. So I brought on one of my favorite salads, loaded with all kinds of fiber with a capital F. Everything was okay. Landed, got to Amsterdam, great, hanging out in the lounge. And then things started to get interesting from Amsterdam into Warsaw, Poland.
Oh my goodness.
And I was like, oh my Lord God, if you just let me make it, I will. And Stephanie's like, maybe it's because you had the salad. I'm like, maybe. So we get off the plane, and that's bad enough. But here's the embarrassing part. We get to a pharmacy, you know, like a convenience store in the Warsaw airport.
Uh-huh.
And the guy doesn't speak any English. So, and all of the medications, you know, are in Polish. And, you know, I don't understand it. So I'm trying to explain to him that I need something that I'm a little too regular right now. I need to slow it down. And so Stephanie's standing there trying not to laugh. And then this guy comes in there who speaks English. He says, oh, do you need help? I said, yeah, I need blah, blah, blah. He goes, oh, you need blah, blah, blah. And then Stephanie starts laughing. Mm-hmm. And the guy goes, oh, yeah, blah, blah, blah. I'm like, oh, my gosh, the entire place just heard what I needed. I was like, oh, Lord. And then, you know, anyway, long story short, limit the fiber when you go on the trip.
Especially for us vegans, right?
Oh, yeah, that was ridiculous. That salad weighed so much. I can't believe I took that on the plane.
Right.
Anyway, but it was good, but I paid for it later. Anyway, thank you so much for being on the show.
Thank you for having me. I appreciate it.
Yeah, okay. So thank you so much, and we will talk to you all on the next show. Have a great day.
All right. Remember, I care.